And if you restore the core, things fall into place. Well, these people are destroying their core with their medication, don't even know it, and do nothing to combat it.
And they're definitely not even at all educating them around that food is medicine, and they're just letting them eat sugar, processed food, fake sugar. Good afternoon, folks. Good day. I hope that you guys are thrilled to be tuned in to the Dr. Chapa Wellness Show. Today, we have a very special guest and a very cool topic to discuss because many of us, all of us, know somebody that is dealing with high cholesterol, somebody that's dealing with high blood pressure, somebody that's got cardiovascular disease. So today I have a special friend, special guest that we're just got to chatting about some fun things after one of our shows and said, you know what, let's hit that record button one more time. We got something special for you guys. So I hope that you guys enjoy Dr. Farella. Dr. Farella, welcome to the show. And first, before we get too far deep in, I want to make sure they know who you are, what you do, and why you do it. So tell us a little bit about you and your practice.
Yeah, I am a pediatrician by trade who then converted over to family medicine for the most part during the whole debacle known as the 2020 pandemic.
Well, plandemic. Yes, I've heard of that.
Well,
yes.
scamdemic.
A scamdemic.
That's right. Yeah. You can Google me, maybe.
Yeah, maybe.
Probably censored. So I went into family medicine because everyone was closed. Everyone was closed. I was open. My practice was open.
Yep.
And so we just started getting calls. The kids were fine, of course. You know, they get snotty noses. They were corona completely immune. And so,
but yet they still had snotty noses. Amazing that they actually have, normal acquired little illnesses.
That natural immunity really kicks some serious butt.
I'm saying.
So, that was one of the things is I just started getting family members of my patients calling me, we can't get our blood pressure medicine. We can't get our different meds or my mother's sick. Can you treat my mother? And yeah, just bring them in. I'm here. I'm willing to do it. So I got quite a taste of the polypharmacy of adults. And I got quite a taste of adult medicine during that time. So,
tell us when you say the word polypharmacy, what does that mean?
Anything over 2.
Wow.
Really? I mean, honestly.
Okay, so that brings a curiosity question is on average, 30 years old, how many meds? 40 years old, how many meds? 50 years old, how many meds on average?
Honestly, if you're 30 years old, you shouldn't be on any meds.
No. Of course, you and I are believers of the, no drug, no surgery plan. But in general, statistically, and I know there's probably an exact statistic, but what you've seen in practice, what would you say most 30, 40, 50-year-olds are consuming in the form of medicine?
I can tell you the 30-year-olds, probably in that 20, 30, 35 range, psychotropics, right? Everyone has ADD as an adult. Everyone has anxiety as an adult. Which then, of course, will usually mess their blood pressure up. So then you add a blood pressure medicine to it. And then, of course, if you add that, you have to take your cholesterol medicine so that your blood pressure is in check. And then their hormones go down. So then they're on hormones, right? So you're on the hamster wheel of life. And then by the time you're 50, I mean, it's
pharma, not of life.
Well, right? pharma life.
Yeah, pharma life.
And with the PH, not the F.
It's very interesting. One of my mentors, he was teaching a class and he's got this picture and it says he was like, he's out for a walk one night. And he said, I took this picture and he takes this picture and it says pharmacy, but the P was burned out, which spells pharmacy.
Yes, exactly. By the time some of the 50-year-olds that were coming in, 5 drugs, easy.
Wow. So every decade, an extra drug.
Oh yeah. Especially if they're veterans.
Oh yeah.
RVA.
Great when it comes to handing out drugs.
That's all they do.
Yeah.
That's all they do. And it's so sad. I mean, we had one vet that came in.
How do the doctors, do they just not know any better? I mean, what's up?
No, I think what's happened is that there's a dilution, especially at the VA, right? Because it's like you get to the VA and you never see the same doctor. You generally don't see a doctor. You'll see, some other practitioner, an NP, a PA, something of that nature. So that's a horror show just in itself. And so that's, and that's the way of the world. A lot of the, I tell people I'm allopathetically trained. And, so as an allopathetic MD, I I've always done things a little different on the holistic, integrative, functional side. And just to keep people healthy, that was always my goal. It's like, no, I don't want to deal with your mistakes. I really want to keep you healthy and prevent them.
For sure.
I don't know, maybe that's a wrong philosophy, but that was always my philosophy. And if you restore the core, things fall into place. Well, these people are destroying their core with their medication, don't even know it, and do nothing to combat it.
And they're definitely not even at all educating them around that food is medicine, and they're just letting them eat sugar, processed food, fake sugars.
Oh, ask a dietitian that's doing... This is one of the things that really set me off. I'm sorry, this is totally divergent.
No, it's great.
But we had diabetes teaching, right? So you send them to these dietitians and they tell them the constant carbohydrate diet. I have never done a constant carbohydrate diet on a diabetic in my entire life because it just doesn't make sense. It doesn't make sense. It does not control blood sugar.
So carbohydrate. I mean, I'm having a hard time saying it because I'm like, did she just say what I think she said?
Yeah, that is the teaching.
So they think that constant carbohydrate dieting is a preventative tool for diabetics.
Mm-hmm. Isn't that awesome? Doesn't make any sense. It doesn't control blood sugar at all. It doesn't stabilize blood pressure at all, because we know that blood sugar levels will dictate what your blood pressure does. And then you end up, that's how you get all shaky and hypoglycemic, the whole thing. And they said, what's the first thing they say? Pop some candy in your mouth. Yeah, okay, if you're in an acute crisis, that's probably okay. But the problem is that's what they're doing over and over and over again. And they're not learning some basic tools. And here's what I found. You're going to love this, Dr. Chapa. So as a pediatrician, I've been teaching mommies how to feed babies starting at age 6 months, because I have this belief that a child should be breastfed, or if we have to go to formula fed for the first 6 months of life. There should be no introduction of foods, okay? Solid foods. There's actually a method to my madness.
I'm in agreement.
One of them is exposure to the gut with certain foods that the gut's not ready to handle can be very problematic.
For a lifetime.
Exactly. Right. And so when you're dealing with this, and I talk to parents all the time, they're like, no one's ever taught me how to feed my child. Because a lot of times people come into me after that period and then they have another child, and now I'm teaching them how to feed that second child. And they're like, wait, I didn't do this with my first one. I said, well, what did your pediatrician tell you back then? They said, well, the baby's 4 months old. Go for it. Literally, that was what they were told.
And see, I teach my patients that it's up to 26 months, the gut lining is still fragile, leaky, for which why it needs milk, colostrum, and all the stuff that comes from mama's milk.
Exactly.
And so,
and enzymes.
In enzymes, yes. It's got everything. It's complete. Yeah. It's complete pre-digested fuel for a weak digestive tract. It's new to the world. It's not weak. It's just new to the world.
Exactly. And so, you have to kind of foster them into it. And so,
it makes sense, right? But we're so disconnected. But it does lead us into this kind of conversation of, you said the constant carbohydrate diet. You teed something up for me there, because essentially I have seen in my practice that drives heart disease.
Absolutely.
And do you know
inflammation? Do
you know that this year marks 2024 100 years that the American Heart Association has been in practice?
Yes, I do know that, actually.
And do you know that they are still number one on the I lose list for finding a resource, a solution, an idea, a new thought of idea on how to fix heart disease? More people are still dying of heart disease in this country. And supposedly we're the smartest, the richest, most resourceful.
Spend the most money on medicine.
But yet, they are number one on the I lose list. How is that? If I never got a patient better at the rate that they're getting, would I be in business?
I say that all the time. I say that all the time. Like I can't even wrap my brain around that one. So sorry.
Well,
that's what going back to the constant carbohydrate diet, it causes inflammation. We know that some people are very intolerant to gluten. They get swollen. What is swollen? Swollen is inflammation, people. If your fingers get swollen, your heart's getting swollen.
If I can't get my ring off.
Right.
Yeah.
Right. All those things. Yeah. Right. So
if you push on your calves and there's an indentation for 3 minutes, it's not good.
No, that's bad. Very bad. If you can't think straight.
Yes.
Right? Even just cloudy memories, having problems with concentration, having problems with thinking, and those kinds of things. That is all inflammation. And so there's not dealing with stress. That's inflammation. All of that is inflammation. And when you're adding carbohydrates to that, that's just adding to the fuel. So that will, of course, lead to the problems with the heart. And so that is one of the things that they would teach people. They come to my office. I'm like, what did they tell you to eat for breakfast? Oatmeal.
Cheerios. Which has more nutritional value in the box than the actual food. It
actually does. Absolutely. And I always tell people, flip the box over. If it says enriched or fortified, it means it's crap. And they had to add something to it so they can market it.
Market it. That means somebody is enriching you essentially by taking $100 from you and giving you $10 back and calling you enriched.
Exactly. It's a horror show. So wow. Those are, and wow. Using that kind of technique to teach kids how to read the back of cereal boxes is very helpful because they market to the kids, right? And the parents are tired. They're going to cave into the kid probably 95% of the time, right? So that's one. And I always tell people, like, you really, really shouldn't. I teach the kids like the big alligator thing. You can eat this many proteins, this many greens, this many colors, this many whites.
There you go.
And so the kids learn that
real quick
in seconds, right? Because I love, baby shark.
But isn't it interesting? Yeah, baby. No, don't do it. Sorry. I know I triggered some of you guys. But it is interesting, like this idea that now the kid is trying to implement a technique like that, and then mom and dad are still fighting the implementation piece.
Absolutely.
And so how does like this constant carbohydrate, high refined sugar, processed food environment drive heart disease? And like what are you seeing in
well look at this. Here's a great statistic that all of us makes me really warm and fuzzy personally.
I can feel it coming. I'm getting a tummy ache.
Yeah. This is the first generation where our kids may not outlive us.
Oh man, that's tough.
Right.
Yeah.
We're talking about 10-year-olds that are morbidly obese. What is this? It's got to be our food. Mm-hmm. It's got to be our lifestyle. There's no other explanation. This didn't happen in the 50s and 60s. I mean, think about what they did in the 50s and 60s. They walked everywhere. They made meal-to-meal plans, right? They would go to the market, get what they needed for that particular meal or maybe the next day and eat those foods.
You're giving me this like memory of when I grew up in Deer Park, which is a small little area, but in the neighboring city, there was the Mexican
Mercado.
Yeah, thank you. And we would go to this big, beautiful place, and you could rub your hands through all the beans, and you could touch the produce.
Absolutely.
It was the farmer's market mecca.
Yeah,
and dude, and I just had that memory of like doing that as a family.
Right.
That was a church outing after
Absolutely.
church.
Yeah, smelling the fruit, remember?
And nobody does that.
Squeezing it.
Yeah. You actually learned how to grab a tomato and how to pick
push on the watermelon.
Yes.
What's the color? Right. So, those are things that are lost. They're like lost arts at this point, but that is why we've just plummeted and we're the most unhealthy country for a real developed country. We're the most unhealthy.
Well, and they're also doing this other thing is they are now, when they're morbidly obese, they do the blood work, and oftentimes cholesterol goes up, and then they throw them on these wicked drugs called statins. I've even had some medical doctors say that they told my mom this when we were at one of her appointments back in the day, who is not on blood pressure medicine and is not on statins, was on 5 drugs and 1 hormone in her 50s, and is 76 plus now, and she is drug free.
She's going to beat you too. You know that, right?
Probably.
Yeah. Just letting you know.
I know. I'm gonna say, don't listen to this, Mom. This is not. I'm not the droid you're looking for.
No, but that's absolutely true. I mean, absolutely true. So during COVID, people would come into me and they have their drug list, and so I would literally go down the drug list. Why are you on this? I don't know. Well, if you don't know, why are you taking it? Okay, let's start again.
How crazy are we?
And I would start with statins because those are my like pet peeve of the world. So granted, I don't have any kids, no kids are on statins in my practice, even though that is allowable by the FDA now.
So tell them what a statin is, just so some of our viewers might not know.
So statins are anti-cholesterol drugs. So they block cholesterol from being produced.
Well, that's saying
super simple.
So at simple level, if God says we're supposed to produce it, and we shut off the mechanism to produce it. Where do we find that that's a good plan?
I have no idea.
I mean, either. Okay,
But
so now
I can tell you, so this spurs some new stuff, right? Because what does cholesterol do for your body? Well, it makes your hormones, right? So you have all these people that are on anti-cholesterol drugs, and now what's happening? There's a
clinics.
T clinic on every block.
Yep.
I don't know if they really know what they're doing. It kind of scares me a little bit, but hey,
it's got to be just as simple as putting a pellet in your butt.
So everyone has to. So now we have pellets in our butts on the cholesterol medicine. Stop the statin. Get yourself on some really good fish oil, high dose. Guess what? Your cholesterol will come down if it's even elevated. Because fun fact, the Framingham study is what set this all up. The Framingham study was done back in the late 90s. I'm sorry, early 2000s. That was this multi-center, high-profile study, cardiac study that went across the country. And, they found that, this was a problem in the United States of America, and we need to combat this blood pressure and heart attack issues. Yeah, all these issues. And so, they were like, we have to prevent high cholesterol. So they actually shifted the cholesterol levels down.
From what to what, you think?
From like 250 to 200. Actually, it's down to 170 for adults too, which that's ridiculous.
Which is crazy. Yep.
Which is nuts. And so people are like, oh, I have high cholesterol. Well, what's your number? 200. I'm like, that's not
192.
Yeah, I'm like, that's not high cholesterol, people. We got to get
And
grip.
it's been shown that it's very normal as we age to allow cholesterol to rise.
Right.
For, definitely hormonal benefits, brain benefits.
I'm Italian. Okay. So I have a ton of vowels in my name. A lot. We have familial hypercholesterolemia. My aunt, who lived to she was 94 years old, had a cholesterol level in the 400 to 500s, and she did everything to try to get that down.
Like with drugs.
Initially, they were putting her on statins, and she felt miserable. Joints hurt. Couldn't get up. My sister was paralyzed from statins. Couldn't get out of bed.
Wow.
She had I think her cholesterol level was 260, and they put her on these statins. And I said, okay, let's do an experiment because this isn't working. And I put her on nutraceuticals, high dose fish oil, CoQ10, and we rechecked her labs literally in 3 months. She dropped 30 pounds. She dropped her cholesterol level from 260 to 230. And by the way, she only dropped, when she was on the statins, she only dropped from, I think, 260 to 255 or something like that. And then it went back up. So we dropped her cholesterol level 30 points. She no longer had pains in her joints. I mean, the whole thing.
The paralysis.
3 months.
Gone.
I said, we're doing a 90-day study. This is just a personal study between me and you.
Yeah.
And I took my dad off statins, put him on high. I'm like, Dad, you're Italian. We have this in our family. You know it.
Yeah.
My aunt lived to 93 years old.
With high cholesterol.
With high cholesterol.
And
I mean, it's, and now they're trying to demonize the Mediterranean diet, which of course
has been around for ages.
And that's what Italians eat for the most part, right? And now I know why. So.
And why? Tell us.
So if you actually go to Europe, around the Mediterranean, Spain, Italy, Greece, you see a lot of old people. And these people are sharp.
Okay.
Super sharp. Why are they so sharp in their 80s, 90s? And you even see centurions out there.
They fish and they eat olive oil.
They walk. They eat tons of olive oil. They eat tons of tomatoes. What's in tomatoes and what's in eggplant? Tons of eggplant. Italian diets have lots of eggplant, lots of nightshades, which have been a little bit, demonized, shady, right? Nicotine.
Oh, come on.
High levels of nicotine.
Okay.
What does nicotine do?
Blood flow.
Blood flow.
Yeah.
Makes you sharp.
Yeah.
Keeps your brain intact.
Acuity. Stimulates all those receptors.
All the things. Helps your lungs stay inflated. So you don't get.
We probably should help people understand that we're not talking smoking.
No, they don't smoke.
We're talking nicotine, very different. And so y'all hear that, like food, that means God provided what we needed in our food to help us stay sharp. So
absolutely, like
tomatoes, eggplant. Now, not everybody likes eggplant.
I don't care. Eat it anyway. I'm just kidding.
That's a good answer. It's a great answer. Sometimes
make some hummus or something out of it.
Yeah, for sure.
Not hard. Chutney, whatever. But eggplant's number 2. So tobacco's number 1. All right. it's not the tobacco that's so bad. It's the chemicals that are put into those cigarettes that let's
And the
not even
burning
go
of
there.
paper.
Burning of paper.
Oh, into the
Exactly.
lungs. I mean, it's
All the things. I'm not saying go out and smoke.
yeah,
That's
yes,
not what I'm
very
saying
clear.
at all.
We are not.
Please do not do that.
Burning. That's right.
No.
However,
But that's just the number
but
one.
nicotine is a
Nicotine's
powerful
high.
herbal therapy.
Right. That's why, back in the day, George Washington, his people, they would
Put a
eat
little dip in.
the dip and the snuff and all that stuff.
But it wasn't laced with glass and
No.
it wasn't preservative based.
There were no pesticides on it.
Yes. I mean, so we do have to just kind of, we shouldn't have to clarify that, folks.
I know.
But the reality is many of you do not know that the things that you call healthy because it's sold to you in a package with a cool label is full of chemicals and garbage that is wrecking your health. So whatever benefit you were going to get, now you just increase the blood volume of chemicals straight to these tissues.
Mm-hmm.
So where would somebody get some of this? Is there you can't just go to a tobacco plant and chew on it anymore. I guess just the eggplant.
Eggplant's number 2, highest, and number 3 is tomatoes. Now, tomatoes, almost everyone has tomatoes. We're in Texas. They make salsa every day.
That's right.
That's okay. Do that,
I can put that straight in the vein.
Right. There you go. So, and that's Mediterranean diet right there. And then add the olive oil and you're golden.
Yes.
So if you just,
and you're happy as a lark.
Exactly. Add some fish in there, some, whatever, Gulf shrimp. Again, watch where you're getting your sources from, please. That's another thing is that we're the breadbasket. The United States was the breadbasket of the world, and we export more food than we keep in our own country, and it's really sad. It's a real sad situation, but we're really. That is why we're in the midst of this mess, because we've relied on pretty packaging, marketing to tell us what's smart and what's cool.
And I guess we don't realize, we ship stuff across the sea and then have to bring it back. By the time it gets back to us, it's been contaminated, adulterated, chemically altered in some capacity.
Absolutely.
I mean,
that's one of the things that we have to really be careful with.
Are the chemicals also driving, essentially what I just heard you say is cholesterol is our friend. It helps balance hormones, brain function, longevity even, but yet we just keep pushing it down to sell drugs. And this is what I was going to tell you is I literally flipped open one of my old books yesterday, and it just fell open to the cholesterol section. And I had this journal from a program I took from Dr. Joe D'Onofrio and Joe Thomas. And these guys had this whole spiel about cholesterol, and Lipitor was one of the drugs, and they had the label, and it clearly said on the label, this has not been proven to prevent heart attacks or stroke, except now today's one doesn't. So this one was an old one. It's like the old pink packet used to say that a saccharin would cause cancer. Now that's not on the label anymore.
Right.
You know what I mean? So when you are taking statins, you got to ask the question you asked earlier. Why are these people taking statins? Because the doctors are telling them cholesterol causes
heart disease.
Yeah.
Usually. Yeah. Or it's a gimme, like, oh, you have high blood pressure, we're gonna give you the statin too.
Multivitamin.
So it becomes this thing, and no one's talking about taking a walk for 20 minutes, or why don't you try high dose fish oil? And I mean high dose. I'm talking 4 grams, 8 grams, 16 grams.
Yeah.
Neurodevelopmental kids, I put them on 8 to 16 grams a day.
And they have tests now that you can actually measure omega-3, omega-6 indexes and see the fire in the body.
Really at this point, I'm just like, anything's better than nothing. Right?
Well, from day one, before they had cool tests, I'd always tell people, fish oil will touch every tissue, cell, organ, gland in your body. And every cell in the body has that bisphospholipid layer. And if you repair that regularly, give resources for good development, you're not going to get a leak in the roof. You're not going to get penetrated in the side. I mean, assuming that you don't back into your garage or anything. That could happen. It could happen.
Yeah.
Yeah. So, but at the end of the day, so healthy lifestyle practice can control cholesterol, and Mediterranean diet's a good one. Do you have any other diets that you like?
I like ketogenic. Keto. I do a lot of keto, especially my neurodevelopmental kids. We do a big high protein.
Does that freak parents out to recommend a high fat butter diet or fish diet to children? And how do you get the parents to give kids, some of these healthier proteins? Because remember earlier you were talking about the big proteins and then down all the way to the the garbage whites. How do parents get freaked out with a keto diet, and do they comply well? How do you get them some tips to get parents to eat with their kids better?
Well, the first message out of my mouth is always this: if it's not good for anyone, it's not good for anyone.
Oh,
right.
Okay.
So everyone should do this. Don't single the kid out. The whole family needs to do this together and take it step by step.
We win as a team.
So why don't we just start with
team.
breakfast?
Yes.
Right? Let's give the kids, breakfast is called break fast for a reason. And if you're going to break a fast, you don't do it with a carbohydrate. You do it with a protein. Let's get the kids on protein. They have to think at school.
It's a log on the fire.
Yeah. And if they, I always ask kids, when do you have trouble in school? So start doing this. Ask your kids this. If they don't eat breakfast, or if they eat cereal or oatmeal or toast or something like that for breakfast, ask them when they start to peter out. The kids will tell you what class they're in. And I can almost guarantee you it's somewhere around 10 to 10:30 in the morning, because their blood sugar went up and then it starts to drop, and it drops about 2.5 to 3 hours after they ate their breakfast, which generally is about 7. Most of the kids are out the door before 7. So somewhere around there is where you see kids are inattentive, can't concentrate. That's their worst class. And then they have lunch, which again is another constant carbohydrate usually. And then they're good for about an hour.
Cookies back in my day.
Right. Up. So here they go shooting up their blood sugar, which they can't pay attention first, because now we're adding to the sugar issue. So they can't pay attention right after. And then they get that postprandial crash, which is about 2 hours later, and they're spent again.
Yes.
Right. So I try to encourage them, like, what does protein do? It stabilizes your blood sugar and your blood pressure, keeps it even. So you're not doing this all day long.
Yeah, that's stressful.
And that really puts the kid off. You want them to be smarter? Give them protein for breakfast.
There you go.
Give them protein for lunch. Try to give them half of their body weight in protein every single day. That's hard.
That's really hard. It's simple, but not easy. Because now you got to, because you're retraining our families against billions of dollars of marketing.
Right. And so, it can be expensive, but it also doesn't have to be.
Yeah.
Right. There's different ways to do it. And parents panic. They panic. I'm like, look, it's not that hard. Grab some protein powder, like PB powders everywhere.
Yes, right.
Something's better than nothing.
Yep.
Use peanut butter, use PB
Probably better
powder.
than the cardboard nutritious breakfast you're getting.
So yeah, the breakfast of champions is
That's
probably way better than breakfast of champions. And throw that in a little bit of, raw milk shake it up, give the kids something to drink for breakfast. That is 1,000,000 times better than, they're great. They're great. Boxes, So if we do something like that,
would be
we
a
teach
fun
them that.
thing. We should just take 5 minutes and just do the little slogans. You know what I mean? It's magically delicious.
Magically, yeah. Especially with that red dye. It's really
right.
magic.
It's real magic. Yeah. So, and it is fascinating. Like a lot of life that I found with patients coming in what I call accelerated aging, food is medicine. And we have gotten so disoriented to know what real food is and what real food isn't. And so guys, I believe that what you just heard is fats are healthy. Cholesterol is healthy. Eating protein for breakfast is healthy. The opportunity you have to start your day right and end it right is in your grasp. You just have to make a decision. And I love what you said about we win as a team and lose as a team. If we as a family get on board, then good things will happen, not just for the school, but even for their production in life.
Absolutely.
And I think we will be less stressed because our body won't be in as much pain. And because that's essentially, if it's not a blood pressure problem, a cholesterol problem, it's a painkiller problem or a psychosis problem.
Absolutely.
And we have an opportunity, you and I, to be a voice of reason for so many people.
Think about so many, now I call it the silver lining of COVID, right? So the silver lining of COVID post-2020 is mommies and daddies are able to stay home. So they're raising their kids. So even if they go to school, the first thing I tell the parents to do is like, hey, if your kid has been trying to be so good all day long, and, because they're not geared to young children doing young children things, right? Go outside, take a walk with the family for 20 minutes while the sun is still shining.
Hit the park.
Before you go and start preparing dinner. And when you prepare dinner, let the kids help you. Teach them how to do things. Teach them to tear apart the lettuce. Teach them to touch and feel food, good food, and they'll learn to like food. I mean, it's really simple. To me, my kids never got a choice.
That's right.
You know, I'm sure your kids didn't have a choice, right?
They don't pay taxes.
No.
So they get to do what they're told.
Until they get a driver's license.
Yeah.
They're under your control.
That's right.
I know this for a fact. And so when in my house, you know, when the kids were little, I would just put out a veggie tray and just leave it and just not pay attention to it. That veggie tray was gone in 2 hours between my 3 little kids.
Yeah.
Fantastic.
Coming in grazing.
That's right.
That's awesome.
Let them do it. And I try to teach that to parents all the time because, oh, my kid doesn't eat vegetables. Have you ever just left a tray out? And you go and you do your little thing and, ooh, this is really good carrot, and walk away.
So essentially, parents.
Modeling.
They are modeling your efforts.
Exactly. Just model.
Well, I want to just give you an opportunity to tell our audience how they can find you and the name of your clinic, because I love the name of your clinic, and then I'll kind of wrap us up.
Sure. So we're A Brighter Tomorrow Family Health and Wellness. We're in Webster, Texas. You can find us at www.abt4kids.com or abt4familywellness.com.
Well, so guys, Dr. Farella and I are in like mind, and we want to serve you guys. We want to teach you how to live better, be better, and give you the power. We want to give you Thor's power. You have been dubbed worthy to take care of yourself so that you can take better care of your family. So we know that all life starts and stops at the cellular level. We want you to believe that, know that, and trust that if it has at some point in time flew, swam, grew off of a plant, if it walked around, if it has a face, if it has no label, you can probably consume it, and we'll call that good food and a fresh start, wouldn't we? That would be a great way to hit a brighter tomorrow. So I want you guys to go out today, eat fresh, vibrant foods, live fresh and vibrant, and experience a brighter tomorrow. And on the Dr. Chapa Wellness Show, I just want to personally say thank you for making my day bright, and I'm so excited to share my podcast with you guys, with them, because guys, this is awesome collaboration to have you here.
Thank you so much.
So thank you.
This is so fun.
Yeah,
this is great.
You guys be blessed today. Do something amazing. And until next time on the Dr. Chapa Wellness Show, do something amazing today.